In recent years, low carbohydrate diets have become very popular and widespread, but how effective are they, particularly for weight loss and maintaining your health?
We've asked Barbara Schmidt, who's a registered dietitian who runs the very successful Transformations weight loss program, to weigh in on this topic.
She joins us on Health Talk. We're coming up.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Our guest today, Barbara Schmidt, joins us to discuss the low-carb craze. Barbara is the Nutrition Lifestyle Program Specialist at Norwalk Hospital.
Thanks so much for joining us.
Thank you for having me here. Thank you.
This is something almost everybody's interested in, dieting.
Right.
And the low-carb craze. What do you mean by the low-carb craze?
Well, I don't like to say low carb, I like to say right carb, okay? So when we talk about carbohydrates are plant foods. And when plants are, we've got our simple carbohydrates like sugar, honey, molasses, and I don't care if it's brown sugar or raw sugar, that's a simple carb. Then we have our complex carbohydrates like our grains and vegetables and fruits, our complex carbohydrates. So we want to focus on those rather than the sugar. So avoid those processed foods, processed flour, white flour, and have whole grain flour, and avoid the sugar, of course.
So what you're really saying is there are three piles here.
Yes.
One is the processed carbs, and maybe you could say a few more words about like pure sugar or white bread.
Right.
The whole carb, the whole wheat carbs, and then the non-carbs as a third sort of group to think of.
Okay, exactly. So when it comes to low carb, the low carb craze, you know, that was basically started with the Atkins diet, where, you know, it was a high protein, but he was also emphasized a lot of fat. And the thing about fat is very satisfying. But there was no distinction. The one thing about the fat, there was no separation between saturated fats or monounsaturated fats. And the saturated fats are the butter or the fat that's on steak. And that will raise your blood cholesterol level, and it's put you at risk for heart disease. So we want to look at our fruits and vegetables and whole grains.
Tell us a little bit about why are simple sugars worse than more complex carbohydrates?
Okay, so what happens is that when we eat simple sugar, our blood sugars rise, our insulin levels rise, and that actually, when you have increased insulin, you're going to store more fat, and it's going to make you hungrier faster. When you eat sugar, I tell my patients, you're going to be hungry within an hour to an hour and a half after eating it.
This is why when you eat a piece of candy, you're actually more hungry to eat candy.
Absolutely.
After it. You binge on that
and
stuff.
And not only that, sugar increases the neurotransmitter dopamine, which makes you feel good. It's a pleasure seeking. So then that also makes you crave. So when you eat sugar or processed carbohydrates like white flour, things like cookies, cakes.
How about chips? A lot of people are eating these tortilla chips. Are they whole? Or are they
Well, that's
processed?
a little different, but that's a little different. But getting back to affecting whether or not we're hungry or not, when you eat those processed flours, the white flour, you're going to be hungry as well. Something like chips have fat, okay? Okay, so that actually is going to satisfy you. You know, that's going to satisfy you. So I do say you're better off, I tell my patients or clients to eat every 4 hours. You want to make sure that when you're eating every 4 hours that you have protein, and the protein is going to have the fat, and that's going to satisfy you. But the protein that we want to emphasize is protein and fat that is monounsaturated. So we want to have fish, chicken, maybe some peanut butter or some nuts, avocado. That will keep you satisfied.
And always in portion control.
Always in portion control.
Because we know that fat has more calories.
Exactly. So many times I'll have patients that come into me, especially because I'm in cardiac rehab, and they're very cute. And they'll be like, oh, Barbara, don't worry about it. I've got my cholesterol under control. I'm having a cup of almonds every night, you know, to keep my cholesterol down. Well, 6 almonds is 50 calories. This is 30 almonds or 250 calories. So if you're having a cup, he's probably having close to 1,000 extra calories a day, and he needs to lose weight as well. So you've got to watch how much of this. Yeah. Or when I tell avocados, they hear avocados are good. Well, 1/8 of an avocado is 50 calories.
So sitting down and hitting,
if I'm having
a ball,
right, if I'm having half
bowl.
an avocado, I'm eating 200 extra calories. If I'm having a whole avocado every day, which I do find, I'm having 400 extra calories. And after a week, then I'm going to put on a pound, because that's going to equal 3,500
So
calories.
just because something has good fats in it doesn't necessarily mean you can eat it with abandon.
You've got to still monitor how much. You want to have those good fats, but watch how much of those we're going to have.
I know when my wife and I were successfully dieting, we took almonds and we put them in little Ziplocs. I think 100-calorie snack, so we knew exactly.
I tell my clients to count your almonds. Put 12 almonds in a Ziploc bag many times. I say fill up your briefcase when you get to the office, put that in your desk, and at 4 o'clock or 3 o'clock in the afternoon, take that bag out and eat one bag of those, get those 12
almonds. And the trick
almonds.
is, again, when they're salted particularly, it's hard to stop after a few of them, because I personally gained about 50 pounds on almonds alone. Well, they're so tasty.
Well, that's why you have to have portion control.
That's right.
Always portion control.
So maybe going back to carbs a little bit.
Yes.
Let's talk about some of the good carbs, the right carbs.
Okay, so the right carbs would be my fruits, fruit and vegetables, I always tell my clients that vegetables are unlimited. You can never eat too many vegetables, because these are low in carbohydrates, But our fruit has sugar. So we need to monitor how much of this we eat.
So tomatoes are fruit?
No, this is an apple. Now I want you to pay
no,
close
I thought a tomato
attention
was a fruit.
How small it is. Or my orange that's really like a clementine. Everything has been supersized. Our food has been supersized, and so have we been supersized. So when we buy an apple, it's hard to find a small apple like this. Most of the fruit that we eat are 2 servings. And a serving of fruit would be half a banana. So I usually tell people 2 pieces of fruit, which is actually 4 servings, But if you focus on things like berries and melon, you can have a cup of them. Raisins, I only get 2 tablespoons of raisins, is 1 serving of fruit. But your fruit, we usually say, as I said, 4 servings a day, and you want to have a minimum of 5 fruits and vegetables a day. But fruit has a lot of sugar. What you want to have, as I said, this is unlimited, your vegetables are unlimited, and when it comes to our breads, we want to have breads that are high in fiber, And cereal, I love cereal, but my high fiber cereal. I eat things like Uncle Sam or Kashi Goleen, not the Kashi Goleen Crunch or the Crisp, because those are high in sugar. I like the plain. As my husband always says, he goes, Barbara, the box tastes better than the cereals because they're low in sodium and low in sugar.
How about artificial sweeteners? There's a lot in the news about them actually being worse for you if you're trying to lose weight.
Right, because what happens with artificial sweeteners is that you need to re-educate your taste buds. Artificial sweeteners are 10 times sweeter than real sugar. So if you get accustomed to always eating that, you always want that. It also does something to your brain where you're having something that tastes really sweet and there's no calories. So your body's like, hey, wait a minute, what's going on here? And it screws up your metabolism. So that actually is detrimental to your metabolism. So I like to get people off the artificial sweeteners. In fact, I'd rather have you do real sugar than an artificial sweetener, but also limited the amount of it that you're having, But getting back to the grains, you want to have 100% whole wheat and whole grains.
And they make whole wheat pasta too, don't they?
They make, you love the pasta.
Yeah, I do, and that's why I keep asking. But I also see sushi you can get with whole grain rice. I know
you can get it with, but still, 1/3 of a cup of pasta is 80 calories. And I haven't put any sauce on this. This is cooked. So whether it's white or whole, high fiber, It still has 80 calories. But the difference is, if it's high in fiber, my body has to work to get the sugar out of it. Because trapped inside of all these carbohydrates are sugar so that my body can process them. And if it's high in fiber, my body has to work like a food processor, and I use 25% of its calories to digest it. I do tell people no white flour, no sugar, and if you're eating starches, that I limit them to 4 a day. You know, but this is the serving. It's a 1 ounce slice of bread, which is also a problem. Most of the bread we eat is really 2 servings.
So the Atkins approach, which was quite extreme, because I remember going on it, was you can't have any carbohydrates whatsoever.
Right, exactly.
You're saying that's not necessary to achieve the benefits.
No, you need to eat a balanced diet. And the problem with something like that, where it's extreme, you can't stay on it. This is about, this is long term. Weight loss is long term. It's changing your life for the rest of your life. It's not just I'm going on a diet and then I'm going off of it.
Do you want to say something about the Transformations weight loss program that you run?
Yes, so I have my program at Norwalk Hospital called Transformations. It's an 8-week program. It's $180, and it's basically my philosophy is that people need to learn about nutrition. So you're learning about nutrition. There's a behavior modification techniques that I give people, and we talk about low carb, right carb, fats, the good, the bad, the ugly. We talk about dining out, reading labels. So you're learning about everything.
So you want people to call you directly at the number on the screen?
Yes, please call me directly on a number on that screen. I'm looking at that.
203-855-3548. Is that right?
That's the nutrition office,
and
there'll be a prompt for me as well. When you call that number.
And this is a paid program, so we can afford to do it. They have to pay. They have to pay
$180
Insurance
a day.
does not cover this?
No. You can get. We do not take insurance for the program. We'll give you the papers if you want to seek reimbursement from your insurance company. But we do not take insurance. It's $180. It's the best deal in town. You get me for 8 weeks. I weigh you. I have you keep a food diary. I give you books, binder, and it's camaraderie. There's usually about six to 8 people in the class. It's nice.
Can you tell us just very briefly a little bit about the interplay between exercise and diet?
Yes. Exercise is key. Okay, I always say exercise is your medicine, and I just try to get people just to get into the routine of it. I say walk. Walking is great exercise. Walk as far as you can for 15 minutes, turn around and come back. You don't need to join a gym, but if you can do that 5 days a week, it's important to do it. Make the time for it. They always say, Barbara, when's the best time? The best time is when you can fit it in. So look at your week. On a Sunday, say, look at the week and plan. Sometimes I do it in the morning, sometimes I do it in the evening. It depends upon my work schedule. But I try to do it every day.
And exercise also gives you a little bit more leeway in calories because you're using up.
No, but we're trying to lose weight, so we need to have less coming in. But also too, that's the cardio, and then there's the strength training, which is your weightlifting or you're doing your floor exercises, core exercises.
And that also helps keep up your metabolism.
Right. The more muscle you have on your body, the faster your metabolism is going to be.
And that's worse as you get older because you tend to have less muscle.
Right.
And we have to stop.
Thank you so much for all your very important tips.
These are great sessions because we could go forever.
Okay.
But we are out of time. I want to thank our guest. We want to both thank our guest, Barbara Schmidt, for joining us on Health Talk and talking about this very important topic.
Absolutely. And please send us your questions and comments to healthtalk@wchn.org.
Thanks for watching.
Be well.
And eat well. Thanks, Barbara.